Okay, so I'm not sure how many more people will be joining, but I think we'll just start now anyway. Thank you for joining today, everyone. And if you've got any questions throughout the talk or afterwards about anything related to medical applications, science degrees, anything like that, please pop it in the chat and I'll try and answer everything as best as I can. So my name's Ella. I'm a fourth year medic at the University of Manchester at the moment. Just about to finish my fourth year. And this talk's going to be on how you can decide whether medicine's right for you and sort of the other options out there, either if you don't get into medicine or if you feel that medicine might not be exactly what you're looking for in terms of degrees. So as an introduction, there are so many different jobs in healthcare, way more than just doctors. It's really interesting, actually, if you look at the structure of like the NHS, who is actually there helping. So if you've always dreamt of being a doctor and working and helping people, it doesn't mean that you have to be a doctor to accomplish that. If you're really interested in statistics, there are loads of jobs in statistics in working within the NHS. There's nurses, there's loads of different jobs. So just because you want to work in healthcare, it doesn't mean you have to go and do a medical degree. Again, there's so many different degrees available within sort of the field of science and healthcare. And they're all great, and it's just which is right for you. So many people will say, which is the best, and honestly, it's just what suits you best, more so than which is actually, the most worthwhile. So things to think about while you're deciding what exactly it is you want to do. Your opinion is what matters most. I hear so many people who are thinking of applying to medicine because their parents really want them to be doctors, or because their whole life growing up they've thought like that's the best job there is, things like that. They're not really great reasons for going into medicine. It's a really long degree, you see really difficult things. And so it's best that you're passionate about it. And if you feel like you're being pushed into medicine and it's not what you think is best for you, then really cling on to that and bear that in mind while you're making your decision. Do your research. Don't just apply. I mean, all you guys here, just by coming to these talks, are doing some research, but don't just sort of jump in head first without knowing what exactly you're signing up for. And think about what is important to you. What is your interests? What are your values? What exactly are you looking for in terms of a university degree? And when you sort of look at them as a whole, is medicine right for you? If not, which of these other options are? So I'm going to spend a little while talking about the different options out there for someone interested in pursuing science at university and as a career in general. And then I will talk to you a little bit later about sort of the things that you might want to bear in mind, the sort of pros and cons of each, and the values you might have when deciding. So thinking about science at university, there's pure science courses, which similar to any other university course, usually 3 years, and you can do longer courses within the different sciences, either taking a year abroad or within industry, which means almost a little like an apprenticeship where you go work for a company for a year. But yeah, usually just standard courses. Medicine is a slightly longer course, usually 5 to 6 years. And obviously you become a doctor after qualifying. To become a doctor, you have to take medicine, and slightly different to traditional university courses. Medical related degrees, things like biomedical sciences, more medical content, but you don't become a doctor at the end of it. So somewhere in between the science degree and a medical degree. And then I wasn't sure whether or not to include these, but I think it's something that a lot of people applying to medicine aren't really aware of, these options out there. And if you're really interested in working in healthcare with patients and and you're not sure if medicine's for you, then these degrees are really helpful, and they're the allied health profession degrees, such as nursing. In the end, you do end up in healthcare career, but they're shorter courses than medicine and slightly less intense. So looking at science degrees as a whole, so they're very detailed and science-based. So what that means is it goes into detail on actual scientific processes, and it sort of just focuses on that instead of any real world application, although it is worth thinking that depending on which science degree you choose, that will vary slightly. Obviously, when you go to university, you don't just do a degree called science, you would choose either biology or chemistry, engineering, something like that, or there's some that are much more detailed, so maybe plant biology, for example, or biochemical engineering, things like that. Yeah, massive choice of degrees, all at different universities, honestly, an endless amount that you can choose from, and again, all focus on slightly different things. 3 to 4 years, again, usually they're 3 years, but 4 years if you want to go and do a year abroad or a year in industry. Mostly taught through labs and lectures, so you'll have lectures, you go home and write some essays or projects on them, and then you also have labs, which is a little bit like school science lessons, where you, let's say you were doing chemistry, you would do certain experiments to sort of demonstrate what you're learning in your lectures and be able to visualize them better. They also have the option for flexible modules. So if you're particularly interested in a very specific topic within your degree that you would be doing, you have the option to sort of choose that. And if there's something you're less interested in doing, you don't have to do that. They do have fixed modules, but usually they're sort of the more general topics, and then you get to choose what exactly you're interested in and go into more detail on those. And again, opportunities for years abroad and placements. They have shorter contact hours. This might not be a phrase you guys are really aware of. Contact hours is how many hours you spend actually in university a week. Usual degrees have quite short contact hours, and a lot of the work you do at home, such as essay writing, things like that. So science degrees do have slightly longer contact hours than an arty subject, but they have short contact hours in the sort of bigger picture of science degrees in medicine. This is really great if you really want a university experience where you'll have a great social life, you'll make lots of friends, if you want to work a part-time job, things like that. You might be looking at having a shorter contact hour degree, and yes, then a science degree might be more suited for you. Yeah, more essays and projects than a medical degree. That might be something you are interested in. Maybe you're really good at writing essays and you want that to be part of where your marks are coming from. That's also, if you're interested a bit more in research, going home and writing essays on things that you've researched yourself might interest you, and they are much more commonly seen in just general science degrees. Yeah, like I said, time for lots of extracurricular activities, literally whatever you're interested in. Time for a part-time job, which is obviously really important for some people. Technically, there's less time socializing with other people from your course, because you go in, you have lectures, you might have projects with small groups of people from your course, but generally people who do science degrees are similar to those who do other general university degrees, where most of the people they will meet will be through societies from a wide variety of different courses outside their degree, which is great. It's a good thing. So the life sciences, or the sort of medical related sciences, are a subcategory of science degrees. Some are more medical related, and often they are quite sort of narrow focused. So you can do like an anatomy degree, or you could do biomedical science degree or biomedical engineering, things like that. Biomed degrees especially are very, very similar to the first couple of years of a medical degree, but they just don't focus on the clinical detail as much. In medicine, you were taught the basic science, and then you're taught how to apply that to real life cases. So, for example, in a biomed degree, you might learn the specific processes that go towards causing a disease, but in a medical degree, you will learn a bit more about how to identify that disease, and focus less on the actual details of what's causing it. So less clinical detail, but you still, depending on the course you choose, can have a sort of medical focus. If you don't get into medicine, or you're thinking maybe in the future I might want to do medicine, but it's not for me right now, life science degrees are really good, because that means that when you do start medicine, you'll already have that really solid foundation of knowledge, which will set you up really well. Everyone I know who's done a biomed degree and then gone on to do medicine does really, really, really well. So if you're thinking maybe medicine in the future, then these kind of degrees are, really helpful. With science degrees, there's options to further your education after your what would be called like a Bachelor of Science degree. So you have the opportunity to take a master's or a PhD. Now, you do have the opportunity in medicine to also take masters or PhDs, but it's not actually that popular anymore, because if you're going to be a doctor, it no longer really, back in the day when I first started my degree, you used to be able to, if you took a master's or a PhD, you'd get extra points when you first applied for your foundation programs the first years you're a doctor. No, it no longer contributes to those points anymore, so it's not very popular to now take a master's or PhD if you do want to be a doctor. And also you have to think, if you're already taking 5 or 6 years, you don't want to take any more years on top of that. But in science degrees, very, very popular to go on and stay at uni for an extra couple of years and get these other degrees. They are much more research and teaching based. So especially PhDs, you do have to do part of your degree would be teaching like younger students. And so if teaching or research is something you're interested in, it would be a really good sort of path to take, to do a Bachelor of Science and then move on and take your Masters and PhD in your subject. And also Masters and PhD subjects are much more narrow. You can choose your field of interest when you take them. And ultimately you can end up working as a professor for the university, or doing research for the university. PhDs, you do get paid, you get sponsored to do them. So in terms of careers in science, you can still work in medicine, you're just not a doctor. So if you think about in oncology, which is medicine of cancers, they have loads of people working in labs looking at microscopes with the different cells under them. And then you obviously have people who work doing the blood tests, things like that. So you can still be very hands-on in terms of patient treatment. You're just not the doctor. Again, like I said before, you can go into research. It could literally be any type of research. So let's say you're interested in healthcare, it could be things like cancer treatment research. But if you're interested in other things, loads of businesses require people to work in the lab. So for example, in cosmetics, in food science, all of those big companies need scientists. Again, teaching, there's so many opportunities within science to be a lecturer, to be a professor, even go back to like a secondary school and teach science. A lot of people who go into science love teaching and will end up doing at least some of that in whatever they go into in the future. But it's also worth saying, like, the skills that you get in a science degree is transferable to any job. Let's say you do chemistry, like no employer out there will think that's a bad degree. I know lots of people who did biology, chemistry, engineering at university and then went to go work in finance or fashion or whatever. So if you're not really sure what it is in the future you want to go into, but you are interested in science at the moment, it is worth thinking that a science degree is not going to sort of shoehorn you into a specific niche at the moment. Let's talk a bit more about medicine, which I think most of you will be at least interested in a little bit. So the degrees are 5 to 6 years, depending on where you go. Usually Oxbridge is 6 years, most other universities are 5 years. There are 4-year courses in medicine, but you have to have a previous degree before you can do them. Everyone studies the same thing for the whole time. There are no optional modules. You obviously just have to learn everything because it's there for a reason. You don't get to specialize until later in your career anyway, so you will be a doctor who needs to know the general stuff. Although, depending on what university you are at, so for example, at Manchester, we have a project each year, just one project, one essay each year, and we're allowed to choose what topic we do that on. So if you're interested in law, you can focus on medical law, or if you're specifically interested in palliative care, which is end-of-life care, you could focus more on that. But generally in the day-to-day, everyone studies the same thing. Again, you do obviously get some scientific background, but it's mainly applied to clinical cases. A lot of universities as well in the last few years are placement based, so you really don't get any more sort of basic science teaching. Again, though, that will vary between which university you're thinking of applying to. Oxbridge and the universities that are more traditional will focus more on research and scientific content, whereas any university which is more PBL based will be very clinical and less so scientific. Obviously, you have to learn practical skills. You'll be taught things like how to examine a patient, how to take bloods, how to do certain surgical techniques. So that's obviously included in medicine. You wouldn't see that in a science degree. And the degree is taught using lectures, labs, and placements, as well as PBL sessions, dissection, communication skills sessions. Again, depends on which university you go to, of course, but there's a much higher proportion of the teaching will be in person, actually getting stuck in, getting involved, and having practical practice, more so than they're actually just sitting there talking at you, teaching you things. Much longer contact hours, especially in your last couple of years of medicine. So I'm in my 4th year, it's my penultimate year of my course, and I'm on placement like sometimes 8 till 7. So like that's obviously a very, very long day. In your first couple of years, it'll be longer contact hours than a regular degree, but probably less so than that amount of time. Yeah, your final years are usually placement focused, and you have a lot of time socializing with other medics because you're always on placement or you're always in university, regularly changing groups, and with so much practical work, you obviously just get to know each other really, really well. But on the flip side of that, you don't have as much time outside of university to meet other people from different courses. Of course, you can do that still. It just happens a little bit less. So if you're thinking, oh, I don't want to just have medic friends, then you know, it's something to think about. Although I would say medicine is a hard degree, so it is nice being friends with people who know what you're going through. So doing medicine like later on in life is actually very common. I know when you're in 6th form and you're sitting there thinking, oh, I've got to make my mind up now. It's actually not really the case. So many people on my course were, I think like majority of people hadn't come just straight from school. There were even people who were in their 40s who were starting medicine at that point of their lives. You might have other priorities before committing to medicine, whether that's maybe you have a child, or whether you really, really want to travel and you know that as a doctor you won't be able to do that, or maybe you want to save some money up, ready to sort of put a deposit on a house before you go and do medicine. That's obviously fine. You just have to know what you prioritize and what's important to you before. sort of before you apply. Maybe you just want to get on with it and go straight into medicine. That's also great, but just think about your individual case, and yeah, it's absolutely fine if you have other priorities. Medicine really is a lifestyle. When you start it takes up a lot of your time, and especially after medical school and in your first couple of years being a doctor, you don't really have time for anything else. Many young doctors aren't in relationships, for example. So if you have other priorities and you want to get them done before going to medical school, it's completely understandable. You might think about taking a gap year if you want to travel, save some money up first. Doing another degree is obviously a great sort of opportunity if you want to go to university now, but you're not thinking about medicine yet. And you might want to go and do another career. Quite a lot of people will go and be a healthcare assistant, for example, and then come back and apply for medicine later on when they're convinced that they do want to do it. Career in medicine feels obvious. I'm sure you guys know what happens once you graduate from medical school. You either become a doctor or a surgeon, usually. Obviously, straight after medical school, there's more training before you can become a surgeon, but generally that's what most people are going to doing. There are also, I think they're called research surgeons, where they primarily focus on research, although any doctor has the opportunity to go into research if they want, or drug development usually is a common one to go into. Medical education is also very popular if you're not thinking you want to do medicine full-time. You can teach medical students, you can teach young doctors, and that can be either sort of bedside teaching, which is teaching the doctors or medical students in the hospital with cases, or that can be like as a lecturer with a university. And there's obviously so many different specialities within each of these sort of subsections, like loads that you won't ever even heard of. I always get surprised when sixth formers say to me, oh, I know I want to be an obs and gynae doctor, because really you guys haven't had any experience of what the different specialities are. And when you join medical school, you'll find all these weird and wacky ones that will change your mind about a million times. So there's, even though after medical school there's really one job that you're going into doing, within that job there are so many different very different subspecialties. So if you're not sure about medicine yet, or you're struggling to get onto a medical degree, there are some other jobs which are quite new. They've only been invented in the past couple of years, which are very, very similar to doctors. They're just not doctors. Primarily, physician's associates is like the really popular one. And what that is you go and do a biomedical science degree usually, and then after that you take 2 extra years at university being taught how to examine patients, clinical reasoning, things like that. And what you then go and do is work in a hospital or a GP under a doctor, and you do a similar job to what a junior doctor would do, taking a history, examining the patient. Then you'll go and present it to your doctor supervisor, who will sort of, you know, make sure you're not doing anything wrong and give you advice on how to treat that patient. And then you go back and you treat the patient yourself. So really you're acting like a doctor, but you just have to be supervised by a consultant. But if you're interested in working in patients and interested in the actual processes that, like the problem solving, for example, that a doctor will do, but you can't get onto a medical degree, then doing a different degree and then becoming a physician's associate is a really good option. And it's really popular now. Advanced practitioners usually do an allied health profession. So very commonly they are paramedics who go back to university to have extra training. And then again, they work similar to a physician's associate, where they do the same job as a doctor, they just have to be supervised. But obviously those training programs are much shorter than medicine, so it's a great option. I didn't really know whether to include this because most of you here will be interested in human science, but obviously there are options in dentistry and veterinary science, obviously as well, nurses within those specialties as well. The courses are very, very similar to a medical course, usually 5 or 6 years, have placements, and they have a similar application process to medicine. So allied health professions, there are loads. These are just some examples of some that you can come across. Literally everything from a nurse or a midwife to clinical psychologist to a physio to an occupational therapist to opticians. And each of those have their own degree sort of assigned to them. So if you want to be a nurse, you have to go do a nursing degree. There are optician degrees available, etc., etc. So they obviously all work in healthcare and are really, really important members of the team. They have a great job because they get to work really directly with patients. Even some doctors don't get a lot of time face-to-face with the patients, but obviously these professions do. Depending on which one you go into, there can be diagnostic work, problem solving, sort of integrated into their jobs. Think of an example. So either, for example, a nurse maybe initially wouldn't have that aspect of work, but as they got more senior, they could have extra training and be allowed to be a nurse practitioner, and then they could be able to diagnose conditions themselves. Obviously, as well, an optician has certain training in terms of eye health diagnostics. The difference is they are very specialised from early on. So usually if you want to be like a mental health nurse, you have to go and do that degree. So you're just very focused on a very specific aspect of healthcare. And there are also options to do apprenticeships in some of those professions. So for example, healthcare assistants, you don't need a degree to do that. So if you wanted to just go straight from university, straight from school into healthcare, there are training courses which are offered by, for example, GPs or hospitals that can get you straight into them without a degree. Yeah, often heavily placement based. I don't know how much you know about nursing courses, especially famously very placement based, but they have almost full-time placements from, I think it's second semester, so halfway through their first year. Whereas medicine, usually you have an occasional placement and then you're fully placement based sort of by midway through your degree. And like from what I've learned from being on placement is allied health profession students are really part of the team and they really help their patients. Sometimes as a medical student, you can feel like you're not really doing a lot to help because obviously you're there to learn, and sort of the work that doctors do is obviously quite difficult sometimes. Whereas a nursing student can do almost everything a nurse can do. They just are being supervised. So really hands-on, really rewarding from early on. And the courses are usually 3 years. You can, of course, do multiple consecutive degrees. So, for example, do like a biomed science degree and then do medicine afterwards. Yeah, come and take medicine as a postgraduate degree. You could also switch degrees before graduating. So very commonly, universities will have all the similar degrees have the same first year. It's quite hard to explain, but let's say general biology and then plant biology, for example, their first year will often cover very similar content. So at the end of first year, if you think actually maybe one of those isn't for me, but this other course, which is very similar, is more for me, a lot of universities will let you just switch degrees at the end of your first year without questioning you. So that's an option. Obviously, as well, if a degree is not for you, you can drop out and start another degree at any point. My point really with this was just that your decision doesn't need to be final. I see so many people who are really stressed about having to make a decision now. You guys are still young, and your opinion on what you'll do will change like a million times, and that's fine. You just have to try things out and not force yourself into anything, basically. You just need to know that there's lots of options out there, and if something's not for you, there is obviously the option to change at any point. So I'm just going to talk quickly about some things just to take into account when you're trying to make your decision. Is it medicine or is it just general science for me? So think about your values and passions. So you might want to do a science degree if you really are interested in learning about the details, really thinking about in-depth information. If you're really interested in teaching as well, a science degree might make that a little bit easier for you, give you more opportunities in teaching. And obviously helping people, if you go into a career in science, you are helping people no matter what you do. Medicine, usually a more problem-solving sort of aspect, clinical aspect, very hands-on, more practical skills, a more practical degree. Even our exams are usually practical. And again, obviously helping people. Allied health professionals, more focused on a very specific topic. If you are interested in, let's say, mental health or eye health or something, you can focus nice and quickly. Team working and the opportunity to work within the team very early on. It's obviously very, very hands-on and less so, sitting down, reading books, and obviously helping people. I wanted to put helping people for all of those because so many people will be like, I want to be a doctor because I want to help people, but all of these professions, help people. So it's sort of a bit of a moot point, really. So what do they require? Obviously, something you need to think about before you apply for a subject is, do I have the right qualifications to let me actually get a place there? So science degrees really vary depending on which university you're looking at, which science degree you're looking at. So really there's something for everybody. Generally, on the whole, lower grades than medicine are required, although very good universities, the grades will be very similar to medicine. So again, it just depends where you're applying. Often you need science A-levels, usually 2, but sometimes only 1. And quite often you should have 1 in the science, which is similar to what you're looking at studying. And your grade requirements may include EPQ. So if you're doing an EPQ, they often will take that into account in a science degree and maybe alter your grade requirements slightly. Medicine is usually 3 A's or an A star, 2 A's, sometimes more than that. I've never ever seen a medical course ask for less than 3 A's, unless you're going through a very specific route where you're a disadvantaged student, and sometimes they will offer sort of special places for those individuals. But high grades, basically. And you need 2 science A-levels, and most universities will say you need chemistry. But they don't mind which the science A-level is. And on the whole, EPQs cannot be counted as they can't be taken into account. Basically in medicine, you won't get altered grades if you've done an EPQ. The only way an EPQ is useful for you is if you talk about it in your personal statement or your interview. But in terms of actually contributing to reduced grades, it won't help. Allied professions, they generally have quite low grade requirements. I think nursing is usually BBC or 3Bs, something like that. And often you need 1 science A-level, or if you're at college, 1 sort of topic to be kind of science related. And then the application process, science is exactly the same application process as any other degree would be, any arts degree or any humanities degree. You just go through Ucas, you submit your personal statement, and then they will contact you with an offer. It's quite rare for them to ask for an interview, although it does happen. I know Manchester interviews for Biomed students just because so many of their Biomed students are actually medics, so they do interview them. And really your application needs to be a focus on why you're interested in the topic you're applying for. Medicine has what's called early application for Ucas, so you have to have your Ucas form sent off by an earlier date than other degrees. You obviously require work experience to like really stand out. That doesn't necessarily mean, you know, doing a week in hospital, but you have to have some experience in the healthcare field, or volunteering, something like that. You have to take admissions tests to get into medicine, the Ucas or the Biomed, and then you always will have an interview for medicine. Allied professions, again, like such a wide variety of within like which you choose, like the applications will vary so much, but usually normal applications, sometimes they have an interview, and obviously they don't always require work experience, but I really would recommend it if you're going to an allied profession degree, because you are sort of shoehorning yourself in quite early on. So I always see people going and applying for mental health nursing, for example, and they've never had any experience working with mental health patients. I would say that's not a great idea, because you might not actually like it when it comes around to actually working with them. The content, science, again, I keep harping on about it, more detailed, more scientific, and sort of less applied, more labs, more experiments, things like that. Whereas medicine is more clinical knowledge, being able to take that information from a patient and working it into a diagnosis, as well as practical skills. And then allied health professions, usually practical skill based. They do have some scientific knowledge worked into that, but it's much less in depth than medicine or science. I've also already talked about this, but if you're wanting sort of a more usual university experience, science is a great option. Less contact hours, more chance outside of your degree to do things. Medicine, obviously more contact hours, but still has a great community, often has its own medical societies, which help work around your specific needs. Yeah, so more specialised to the needs of a medic, for example, having more flexible training times for the sports societies. And then again, allied health professions, much more contact hours, very placement based, but again, great community, really lovely people. Life after university, science, massive opportunities, massive amount of different opportunities. Really depends on what you're looking to get out of a future job, but usually those jobs are 9 to 5. Medicine, following graduating medical school, you have 10 years before becoming a consultant, and during that time you have a lot of exams, a lot of learning still to do. You are guaranteed a job after university. It's not like you have to go and choose one and apply, you were just guaranteed one. But the hours are very antisocial, a lot of hard work, very emotional work. Great work. I feel like I'm being quite harsh on medicine. I obviously chose medicine. I love it. It's a great, very rewarding degree and career, but it is worth thinking, am I ready to sort of, you know, focus on medicine? Am I passionate enough to really want to give all that time to medicine? Because if not, maybe science is more sort of down your alley. And then allied health professions, start earning your money really early. Can be antisocial hours as well, obviously, depending on which profession you're going into. And again, you're pretty much guaranteed a job. I know a few people who did allied health professions. So for example, one of my friends is a paramedic. I'm still at university now. She has graduated. She's the same age as me. She's put a deposit on a house. She's very, very happy. She's very settled now. So it's great if that's the kind of thing you're looking for, wanting to settle down quite early and getting to work and help early on. And I was going to say something else. And the other thing is, as well, is the NHS needs so many more allied health professionals. So there's so many jobs available everywhere, so many degree places available. Again, I've already talked about that. So if you're still not decided, There's like where to go next is you need to talk to some real students doing those courses, ask questions to every medical student you meet, literally pester them. We all are so happy to talk and answer your questions. But yeah, just talk to real students doing that course. They're the people who know best as to how that course is running. Yeah, ask so many questions. If you're sitting there and not asking questions, then it's really a wasted opportunity. If you go on an open day, for example, just ask anything that you're like worried about, anything that you're confused about, and people will answer it. Everyone doing all these courses are super friendly. Read books and articles on the topics. There are so many books out there written by doctors about the life of a doctor. Really great one is Adam Kay, This Is Going to Hurt. You might have watched the recent program of that. That's very depressing. It is kind of accurate, but also very depressing. So just watch that with a pinch of salt. But the book is very, very good. There are so many others out there. Read science articles, things like that. See if you're interested in the more scientific research-based aspect. And do work experience. If you've not had the chance to see healthcare from the point of view of healthcare workers, then how can you know like for sure whether you're going to like it or not? I think so many people are hesitant when they haven't had the chance to do work experience because they think, oh, I'm sort of jumping into the great unknown, which medicine really is, because you won't have had the chance to ever have studied medicine before going to university. So in summary, prioritize what's important to you. What you want is the most important, more important than what anyone else wants for you. Just think of the pros and cons, because there are massive pros and massive cons for all of those options. And think about what you want for your future. So I'll answer some questions. I'm just going to grab some more water quickly because my throat is seizing up a little bit. Please just put some questions in the chat and I'm happy to answer them. Okay, someone asked, will there be a talk about the difference between dentistry and medicine? I don't think there is. I don't think there is, but I think that SixMed has information on it on their website from what I remember. But I don't think there's going to be a specific talk on it, so I'm sorry. If you have any questions about dentistry and medicine, I can answer it. I obviously never applied for dentistry, but I have friends who did, so I can try and talk a little bit about it, but it is not my area of expertise. Okay. What is a typical job following on from biomed anatomy degree? So it really depends on what you're interested in doing. There are so many different jobs that are available. Obviously, if you go and want to do a PhD, then your job will be very research-based or teaching-based, or if you want to go into actual healthcare with your degree. Lab techs are the most common, but within that, there are so many different job opportunities. So like I already said, you might be working with a pathologist, for example, and doing histology, which means looking under microscopes at the different cells. You might be more pharmaceutical based, where you're looking at the effectiveness of medication. It really depends on what you're interested in. But again, there's no, it doesn't mean that just because you've done a biomed degree, you have to go into one of those jobs. You don't have to go into like a sciencey job if that's not what you want to do by the end of your degree. There's also, you know, working with the police is another option, doing postmortems and other sort of post-death kind of analysis. There's jobs within that. There's just so many out there. And just working as a prison officer, first responder in a variety of incidents counts viable work experience. Yeah, absolutely. I always say the most important thing when it comes to work experience for medicine is what you learn, not what you did. So you could work in a charity shop and that's incredible work experience. So as long as you can say, you know, I improved my communication skills, my team working skills, I was able to appreciate whatever, as long as you can say that from your experience, then the work experience is great. And so I assume working as a prison officer, you have had the opportunity to see people, very vulnerable people in difficult situations, as well as you must have great communication skills to do that job. The only thing is, if you're going into medicine, just try and at least talk to a doctor about like what exactly it is they do. But other than that, no, prison officer is a great experience. Someone said, how has your experience been at Manchester? I personally love Manchester. PBL-based learning was always like very appealing to me. And so that's one of the reasons I chose Manchester, as well as the fact it's a very friendly university. Very like big priority on making friendly doctors, as well as like competent doctors, but very friendly doctors. So that was also something that appealed to me. I've enjoyed it, and we get a lot of very hands-on placement experience. We start placement in third to fifth year, we do exclusively in placement. So that was all great, and it was full body dissection, which isn't offered that often anymore. So that was great. I've enjoyed it. A lot of people I know like it here, I guess. But if you're not interested in PBL, then I would avoid it because it's super heavy PBL. Someone asked how much study of physics and maths is required in medicine. Like, not a lot. I didn't do physics or maths for A-level, and maths was never really my thing. The only time you need maths is for drug calculations, so calculating doses, but that's very simple maths, to be honest. But again, if you're very interested in like radiology and things and more into, I don't know, the like engineering aspect of medicine, then physics and maths is obviously going to be much more applicable there. Someone said, if you are sure of medicine and you're in an interview where they ask why medicine, not XYZ, what is a good response? I think this is like the question that scares everyone the most, from what I, like, even from when I applied, this is the one that people really hated, because people would sort of spout off their answer of, this is why I want to be a doctor, and they'd be like, okay, great, why not a nurse then? I would say try and make it as individual to you as you can. It's not always possible, but if you can, then do. But generally the reasons why you might want to be a doctor instead of an allied health professional would be like being a team leader instead of just a member of the team, more problem solving, I suppose, the ability to prescribe, more opportunities to go into research. Generally, you know, nurses or midwives, they don't usually go into research, although they can, but they just usually don't. So things like that are more medical than allied health profession. But I would say try and get some work experience. I know with COVID it's really hard for you guys, but if you can, then you'll be able to get a feel and make sure that you want to be a doctor and not a nurse, for example. The one really good piece of advice someone told me though was like, don't ever slag off one of the other allied health professions, because quite often they get a nurse to ask that question. So when people are like, oh, nurses, like, they can get a bit upset with you. So just try not to do that, but acknowledge that everyone in that team is important, but leadership, research, becoming an expert in your field, and problem solving, I would say. Someone said also, if I was to do biomed, then medicine as postgrad, how does that work with student loans, course fees? Oh, I'm a Scottish applicant. Okay. So, I'm sorry, guys. I'm sorry about my throat. So I'm obviously English, so I don't fully know how the Scottish system works, but in terms of student loan, student finance, you get 4 years of loan, and then any additional years you take is NHS bursary. So your first 4 years you get whatever student loan you get, and then the NHS bursary is a lower amount than you can get through student loan, but you don't have to pay it back. And then I think you can get that for 2 more years. But that is obviously an issue for postgrads because they do have to pay, especially if they go and do an undergrad medicine degree after their Bachelor of Science, because then they're doing 8 years, so they don't get funded for all of those years. They have to pay for some of them themselves. If they ask us why med and not biomed during interview, what would a sample answer be? I think that probably wouldn't come up as a question because medicine is much more like practical than biomed. So I don't necessarily think it will come up. I guess biomed is more research based. You don't really get patient interaction as much. So the actual wanting to be face to face with patients, the diagnostic, prescribing again, would all be positives for doctor over biomed, but I don't think that probably would come up. As a doctor, do you think medicine degrees awarded from European medical schools are worth it in terms of training and skills obtained by doctors working for the NHS, comparing those doctors graduated from UK and Europe? I think going to European medical schools is very popular, actually. Like, I know quite a lot of people who did go abroad if they didn't get into UK medical schools, and from what I know, they've all enjoyed it. I think outside of UK medical schools, the medical schools, basically the medical schools that aren't UK medical schools are very focused on like the like science and the educational aspect, more so than the clinical application. So they're really great, and everyone I know who went to those universities is incredibly clever, but sometimes they just struggle a little bit getting into the swing of actually taking a really focused history from a patient, or those sort of skills. But obviously they can pick those skills up very quickly. So all universities, all medical schools outside the UK are great, to be honest, as long as it's not a super dodgy one in the middle of nowhere. They're great. And then outside of Europe, the medical schools are like exceptional. So they're all great. Everyone I know who's been abroad, medical schools enjoyed it. So I've applied for dentistry before, but as a person that got rejected, how do you think getting an updated experience would be a good idea? So if you've got the opportunity to get more experience, I obviously would. I would just say, like, for anyone who gets rejected from medical school, dentistry school, anything, just reflect on your past application and try and identify where the downfall was. So if you got rejected because of an application test score, for example, or an interview, usually you can request feedback from universities. Usually they'll give it to you, but if you can't, try and think yourself as to where were you less confident, where were you less sort of sure of yourself, or struggled a little bit more, and try and work on those areas. Any experience you can get, though, will improve your chance of getting in, not just because like on paper you then have more experience, but because you'll become more confident and becomes more sure if your answers into, for example, or your motivation will get better. So I always recommend more experience if you didn't get in first time, but also focus on the other aspects of application as well. And someone said getting experience in labs, hospitals is hard nowadays because of COVID. Yeah, I know it is. It's really hard for you guys. So like I said, volunteering is always great. Back in the day, people always would volunteer with care homes, which is incredibly difficult now with COVID. GPs are a great one if you're looking to do medicine, because especially if you're in the middle of nowhere, they often don't have medical students there, and they'll happily take you for a couple of days. That's where I got my work experience before I went to medical school. Similar to if you've got like a private dentist near you, they might be similar. Alternatively, there's a lot of like online experiences now where you can watch surgeries, for example. I don't know what the equivalent would be in dentistry, but I know you can watch surgeries or go to talks on medicine just to show that you're interested, and they're great experiences. I think that's all the questions at the moment. If anyone's got any more questions, please add them. I'm sorry if I didn't answer any of your questions correctly, but I tried my best. Also, if you don't have any questions, feel free to leave. And I hope it was helpful for you guys. Have any of you got any more questions? So I think it's worth reflecting on everything. Obviously, if you didn't have the best Ucas score and you think that's what's contributed, then obviously you kind of got like smoking gun, as if you want to say it like that, where it probably was just down to that. And I'm sure now you know how to work on your UCAT technique to basically get a better score next time. And even like the fact that you've done it before, that will make you less stressed during actually taking it, and you'll be able to perform a little better next time. But I would still just sit back and like reflect on all other aspects of your application, because obviously when you reapply, you want to be super strong in all aspects. So I would say, obviously, yeah, focus on your UCAT, but make sure that you're still working on all the other aspects, just so that you are able to sort of go in and be really strong and definitely get a place. That's okay. Do you have any other questions? So, what do you mean? So, do you mean like an interview question about? Um, yes, so sometimes questions like, what would you do if you didn't get in? Those kind of questions come up, I assume is what you mean. Like, you could then reflect, I suppose, on what happened last time and how you've worked on improving that. So I know there's other questions as well that potentially could come up, which are like, how have you overcome not adversity, I don't know how they word them, how you overcome like setbacks and things. Yeah, of course you can include that you didn't get in first time, and then just make sure you discuss what you've learned from that experience. So saying like I didn't get in, and when I reflected, reflection is like a big buzzword. So as long as you say like I reflected, I identified these issues, and I've done X, Y, and Z to improve them. So, you know, I took more experience. I obviously practice more, but things like taking more experience looks really, really impressive. So of course you can include it, and just make sure you don't sit there being like, I didn't get in first time, and then leaving it there, because obviously that's not great. But if you can say something like, I didn't get in, obviously it was difficult, but when I reflected, I saw that that these were my weaknesses and this is what I've done to improve it. And now I am much more confident, much more ready to, you know, do whatever. I think that looks really impressive. So as long as you include what you've learned from those experiences, yes, of course you can include that. Do you have any more questions? I'll just give you one more minute in case you're typing, but feel free to leave if you have any more questions. No worries. Good luck this time. I'm sure you'll get it. I'm sure you'll be fine. Yeah, I'll have my fingers crossed for you as well.